In major supermarkets across the United States, shoppers can find massive jars containing 1,000 ibuprofen tablets sold as casually as bags of potato chips. While this scene may appear surreal to international visitors, it serves as a stark reflection of a nation grappling with a unique crisis of chronic pain and dietary habits. Though the United States accounts for less than 5% of the global population, it consumes 80% of the world's opioid supply, and the misuse of over-the-counter painkillers is similarly staggering. The existence of these industrial-sized bottles is not a retail quirk but rather a necessity for a society trapped in a self-reinforcing cycle of high-sugar diets and persistent physical discomfort. The demand for such high volumes of medication is rooted in a widespread epidemic of chronic pain that affects more than 1/3 of the American population. Unlike other nations where such issues are often linked to aging, pain in America is increasingly prevalent among younger demographics. Fitness enthusiasts consume ibuprofen like candy to manage muscle soreness, and office workers keep bottles in their desks to combat daily aches. This phenomenon is deeply intertwined with the American diet, which is notorious for excessive sugar consumption. High intake of fructose and sucrose triggers the release of pro-inflammatory cytokines, leading to low-grade systemic inflammation that serves as the biological foundation for joint pain and backaches. The situation is further complicated by a biological feedback loop involving taste and medication. Scientific research suggests that nonsteroidal anti-inflammatory drugs like ibuprofen interact with sweet taste receptors on the tongue, temporarily dulling a person's ability to perceive sweetness. To compensate for this diminished taste, individuals often consume even more sugar to achieve the same level of satisfaction. This extra sugar fuels more inflammation, which leads to more pain, eventually forcing the individual to reach for more painkillers. This cycle creates a chemical trap where the remedy for the pain actually encourages the dietary habits that cause it. This reliance is bolstered by a regulatory environment that allows the United States to be the only developed nation where prescription drugs can be advertised directly to consumers on television. These advertisements often skip the medical complexities and instead sell a vision of a perfect life, showing people hiking or playing with family after taking a pill. Furthermore, because ibuprofen is available without a prescription and without purchase limits, it is easy for households to stockpile massive quantities. For many families living in suburban or rural areas far from a pharmacy, the 1,000-count bottle is seen as a practical, cost-effective necessity rather than a warning sign of overmedication. However, the convenience of bulk medication comes with a heavy price. Long-term reliance on ibuprofen is linked to gastrointestinal damage and the decline of liver and kidney function, while the broader culture of drug dependency contributes to a public health crisis involving over 100,000 overdose deaths annually. The American miracle of the 1,000-pill bottle ultimately reveals a lifestyle where pills have become a substitute for healthy living. It serves as a global cautionary tale that when medication becomes a shortcut for addressing the consequences of a poor diet and sedentary lifestyle, the path to relief may actually be a road toward chronic illness.